love that drone shot. Still wish I could fly like that. You probably wish you could fly like that too, but we don't have the feathers, and it's probably a good thing. A good thing you're going to enjoy is today, right where you're at. Good morning and welcome to the 33rd Annual Salute Seniors. It is our second day. It is brought to you by the Colorado Gerontological Society. I'm Adam Morgan. Now, the Salute to Seniors is an opportunity for you, our viewers, to learn more about the issues of interest and concern to older adults, for sure, and to have some fun and win yourself some prizes. Older adults have joined us throughout the years at the Colorado Convention Center for this day of information, resources, and a lot of fun. Joining us over the years, we have learned about Medicare, housing, and home care. We have enjoyed hours of entertainment from celebrities like Alice Faye, the Lawrence Welk Music Hour stars, and Jerry Mathers. You know him, Beaver Cleaver. And most of all, we've had lots of fun taking pictures, bingo, and winning prizes. Well, we know some of you would like to join us, make it in person. With the current increase in COVID-19 variants, out of extreme caution, we're coming to you for the third year in a row virtually. By coming to you virtually, we're able to share our message with you regardless of where you are in the world. Now, for those of you who joined us yesterday, thank you for returning today. And to those of you who are joining us today, we know you're going to enjoy the program. Now, before we get started, we want to thank the Board of Directors for their continued support of the work of the Society. In addition, we want to thank the staff of the Colorado Gerontological Society, especially Lena Blozes, who supported Howard Dult, the project manager. The Society offers a range of programs for older adults, including grants for vision, hearing, and dental services, advanced care planning, telephone buddy, Medicare and Medicaid counseling and referral for older adult issues. In addition, the Society provides education and training on a range of aging issues, including training for assisted living administrators, for aging in place, and much more. And lastly, advocating legislation that benefits older adults and their families. Place I want to tell you about. It's our porch. Yep, the porch of the office right where we're at right now. Now, you can come on over. It's at 1129 Pennsylvania in Denver. It's the Colorado Gerontological Society. Between now and 5 o'clock, you can pick up applications, other resources, and a lot of good stuff right there on the porch. So stop in the drive, walk up to the front porch, and grab the items. Grab the items that are of interest to you. Some of those items that will be available include the Colorado Senior Resource Guidebook. That is really instrumental. Everything in one spot. You're going to need that one. Health Insurance Toolkit, Medication Disposal Kits, information on society programs, information on the Tabor tax refund, information on the Affordable Housing Income Tax Refund for seniors, and on Medicare Mondays, and a lot of other good stuff. Now, with that, we're going to bring you a combination of educational programs and an opportunity to try your hand in online trivia and some entertainment. Our title sponsor for the 33rd Annual Salute to Seniors is Cigna. Cigna offers a range of health insurance products for older adults, including Medicare Advantage plans, Medicare supplements, and prescription drug coverage. Here is a short message about the insurance products they offer to older adults on Medicare.
We know understanding Medicare can feel overwhelming, so we're here to help answer the most common questions, starting with the basics, such as, what is Medicare? What are your options? And when and how can you decide on the Medicare plan that's right for you? First, a bit of background. Medicare is government-sponsored health insurance for people 65 and older. It's also for those under age 65 who have a qualifying disability. Medicare is funded through your federal taxes. Once you're eligible to receive Medicare, the federal government deducts money from your monthly Social Security benefit. This, plus what you pay while you're working, funds your Medicare coverage. Understanding the different parts of Medicare will help you determine your options and what's right for you. Original Medicare has two parts. Part A covers expenses for hospital visits, hospice care, and some home health care. And once you turn 65, you'll likely be automatically enrolled. Part B covers 80% of most medically necessary doctor services, outpatient treatments, certain medications, medical supplies, and durable medical equipment after your annual Part B deductible is met. If you enroll in Part B, you'll pay a monthly premium based on your income. You can apply by contacting your local Social Security office. Once you enroll in Original Medicare, you can add Medicare Supplement insurance. It's an optional policy offered by private insurers that helps pay for what Original Medicare doesn't cover. This includes out-of-pocket costs such as certain copays, coinsurance, and deductibles. You can also add prescription drug coverage, or Part D. This helps cover the cost of certain prescriptions, so it's important to know if any medications you're taking are covered. This plan is optional and offered by private insurance companies. If you choose a prescription drug plan, you'll want to enroll as soon as you're eligible because late penalties can be pricey. You also have another choice, a Medicare Advantage plan, also known as Part C. This is an all-in-one plan that offers the same coverage as Original Medicare, plus added benefits that may include prescription drug, dental, and vision coverage, as well as hearing services and fitness programs. When it comes to enrolling in Medicare, your first opportunity begins 3 months before your 65th birthday and continues for 3 months after your birthday month. This is called the initial enrollment period. Each year, the annual enrollment period begins October 15th and ends December 7th. This is your chance to enroll in, switch to, or drop a Medicare Advantage plan. Immediately after, on December 8th, the lock-in period begins and runs through October 14th. During this time, you may return to Original Medicare, but cannot switch to Medicare Advantage unless open enrollment has begun. The open enrollment period starts January 1st and ends on March 31st. During this time, you can make a one-time switch to disenroll from your Medicare Advantage plan, switch to another plan, or return to Original Medicare. There is also a Medicare Supplement open enrollment period. This lasts for 6 months and begins on the first day of the month you turn 65 or older. You must also be enrolled in Medicare Part B. During this time, insurance companies cannot refuse you a plan or charge you more based on your health. You may also qualify for special enrollment periods throughout the year for certain qualifying events such as moving, losing employer coverage, receiving Medicaid benefits, or other reasons. All Medicare recipients have certain rights, so if you have questions, contact the Centers for Medicare and Medicaid Services or your State Department of Insurance. You can also reach out directly to your insurance provider. There is a lot of information out there to help you decide on the best Medicare plan for you. Medicare.gov is a great place to start. You can also call 1-800-MEDICARE 24 hours a day, 7 days a week. Ready to speak with a licensed insurance agent? We're here to help you feel empowered, informed, and confident. Call 855-206-5170 or visit ExploreCignaMedicare.com. Thank you for your time. We hope this presentation helped answer your questions about Medicare.
The Colorado Gerontological Society is a not-for-profit organization that provides advocacy, information, and assistance to Colorado seniors, as well as education and networking for aging professionals since 1980. Eileen Dougherty has been the executive director since 1982 and tells us about their services and programs.
It has been my privilege to develop a responsive organization to the needs of professionals, older adults, and families. I view my role as needing to have strong working relationships in the community, as well as knowledgeable and expert board members, staff, and volunteers who can meet the needs of Colorado's older adults and their families. I feel it is critical for CGS to focus on accessing information impacting the future of aging at the local, state, and national levels. Older adults and their families are encouraged to call or visit the Colorado Gerontological Society for assistance regarding long-term care services, questions on Medicare and Medicaid, food supplies, or advanced directives. A counselor will consult with the individual to understand the problem, work to identify and prioritize solutions, and help to arrange services. Services may be provided by our staff, other agencies, or volunteers. CGS is a professional membership organization that provides leadership, training, and technical assistance and support to companies working with older adults. CGS works to promote the dissemination of information by hosting educational programs, leading advocacy efforts, and providing for coordination and networking opportunities.
Let's learn about some of the programs CGS provides.
In our continuing efforts to serve the Colorado senior community, the Society has several ongoing programs and special projects. These include providing application assistance and forms for a variety of public benefits, resource lists for legal, health, and home maintenance, counseling on Medicare and Medicaid, as well as private insurance and long-term care planning, assistance with tax and claim filing, and a robust searchable database on our website to help with finding nursing homes, assisted living, independent living, and low-income housing, as well as home care, hospice, and adult day programs. The database lists prices, funding sources, services, and more. Through a grant from the Denver Regional Council of Governments and supported by community donations, the Society administers the Senior Answers and Services Vision Program to provide limited financial assistance to Denver metro area seniors age 60 and over for the purchase of eyeglasses. For those approved for a grant, the program will provide money for an exam, frames, and lenses. The hearing program, also supported by the Denver Regional Council of Governments and private donations, will pay for an initial grant for those age 60 and over to have an exam done to evaluate the individual's hearing loss. Based on the audiologist's exam, hearing aids, ear molds, and rechargeable batteries can be provided as part of the grant. The program is available to Metro Denver residents. The dental program is supported by the Colorado Department of Healthcare Policy and Financing and private donations. It will pay for exams, x-rays, fillings, extractions, partials, and full dentures for those age 60 and over who live in Metro Denver and on the Western Slope if you live south of I-70 and west of I-25. Individuals cannot have Medicaid or private insurance. As a leader, I have found that it is important to build coalitions, negotiate, and resolve conflict in order to achieve viable solutions. I am a strong believer in the value of networking to help in developing an understanding of the external and political factors that affect the Colorado Gerontological Society and the older adults that we serve. I often see my role as bringing together other leaders to collaborate on common concerns. Because of this approach to leadership, the Society is seen as a valuable partner in community negotiations, compromise, and alliance building.
For more information to get involved with CGS or for help for you or your loved ones, please call 303-333-3482. The team at Colorado Gerontological Society looks forward to working with you for the betterment of the Colorado senior community. Visit their new website at www.senioranswers.org for more information on their programs and services.
Older adults really want to continue to age in their own homes. Using technology is one way that older adults can increase their independence. There are a number of technological advances that you can take advantage of. Turning on lights remotely, robot vacuum cleaners, medication alarms, closing Venetian blinds remotely, and much more. Eileen Dougherty is the executive director of the Colorado Gerontological Society. She will be sharing some ideas on technology. Eileen's areas of expertise include management and administration of nonprofit organizations, education and training on issues related to older adults, and policy development on senior issues, and clinical practice and working with seniors and their families to manage their lives in later years. She has been the director of the Society since 1982. She teaches nonprofit management at Fort Hays State University. Let's connect with Eileen Dougherty.
Using technology to age in place. Hi, I'm Eileen Dougherty. I'm the Executive Director of the Colorado Gerontological Society. We are here to talk to you about creating a smart home in which you can use technology to stay in your home longer. Most of the time, the technology that we're using is tablets or smartphones. These devices today have touch screens, they're easier to use, and we can actually talk to them, they can talk back to us, they can manage some of the technology. There are two types of devices that you can use, or that are frequently used. One is the Amazon Alexa, the other is Apple Siri. Both of these use some type of Apple or artificial intelligence. They have the ability to use virtual assistants to talk to us, and many of them have the ability to talk back. With that type of technology, we are able to help people to stay in their own homes longer. In order for you to do that, though, you probably will need to convert your home and make some very significant changes in your life. They can help, though, with activities of daily living. They can help with keeping you, letting you age in place for a longer period of time. The home automation that we look at is primarily you can control your home with the push of a button or with your voice command. These devices are connected to the internet, a computer, or a smartphone, or sometimes all three. We can tell them what we want them to do. We can send information, or they can tell us what they want us to do. Some of the devices that you might want to consider include smart plugs, both inside and outside your house, security cameras, remote doorbells. Those help us to determine who's outside our house. We can speak through them. Smart locks, thermostats, LED bulbs. A really important thing for people who are having more difficulty taking care of their home might be to invest in a vacuum robot or a floor mop robot. Similarly, people who are having difficulty managing their lawn may want to consider investing in remote sprinkler systems as well as robot lawnmowers. All of these devices can help you to, again, manage when you are unable to do the tasks yourself. And many of them allow you to be independent because you do not have to hire someone to do those. You may have to incur an initial investment, but then you do not have an ongoing investment. We also can look into smart kitchens. Smart kitchens include smart refrigerators, ovens, dishwashers, wash machines, dryers, trash cans. All of these devices, you can look at the status of them, where you are in terms of processing. They can add items to your grocery list. They can tell you whether or not the work has been done, whether or not they have been opened. The trash cans are even way cool in the sense that they can help to control odors if you don't get your trash taken out in a timely fashion. Smart bathrooms are even more cool in terms of the smart toilets. They not only usually offer touch-free flushing and sensors to close the lid and open it, but they also offer bowl cleaning and deodorizing, again, helping with those tasks of staying in your own home and not being able to do as much cleaning. Similarly, the enhanced showers. You can turn on with an app, you can save the shower settings. This prevents people from getting burned or scalded with heat. We also now have the opportunity, many of us have pets, so we can use smart pet care. They have smart litter boxes, which can be washed and sanitized and dried and filled themselves. We have feeders that can automatically dispense food and water, or we can control that from a phone or an app. We also have pet doors where we can monitor whether or not the pet is going in and out, and again, saving the individual having to get up and take them out to do their daily business. Another thing that we can invest in is technology to improve safety as we want to continue to stay in our own home. These personal devices provide us with basically various kinds of technology. They provide us with sensors. Some of them are voice activated. Some of them have GPS or Bluetooth, smartphones, cellular data, mobile phones. So we use a large number of different connectivity devices to be able to actually manage them. Some of these devices then we wear, and of those that we wear, usually most of them can be remotely controlled. So we can use smart watches, fobs, invisible fences, insoles in shoes. All of these things can help track the activity of an individual, where they're going, to make sure that they're safe either inside their house or outside of their house. In addition to that, we have some devices that can be worn, that are usually GPS tracked. We can wear patches, we can have pendants, we can have jewelry. So again, just using various devices to make sure that we know where we are. These are especially helpful for individuals who may wander. In terms of managing chronic disease, we also have a lot of technology that comes into our homes. One of the things that has been expedited with the pandemic is telehealth. Virtual visits, they are faster, they cost less, they can expand the group of people who can help you. Oftentimes we find that people are not canceling appointments. They don't require that you have any transportation. You can do them from your own home. You can be anywhere in the world as long as you have either a phone or some other type of device that hooks up either to the internet or to a telephone line. Some of the devices that we use also, in addition to supporting telehealth, can be blood pressure monitors with the ability to remotely record blood pressure and pulse. We can use other types of wearable devices that can manage whether or not we are falling or tumbling. We can use glucose indicators for people who are brittle diabetics to manage their sugar. We can do voice applications for medication minders telling us to take our medications. We can do exercise and calorie burning takers to monitor the nutritional intake as well. Now, in using this technology, there is going to be some trade-offs. The true trade-offs are cost and privacy. So you have to decide whether or not you want to give up privacy and whether or not you want to incur these costs. So some considerations for these different devices are that there usually are some type of monthly fees for either the cellular technology or the Bluetooth. Sometimes you can save some money by bundling some of these costs through an internet provider. And then you also need to decide where this GPS range is, whether you want to be able to track people anywhere in the world or whether you want to be able to do those for only short distances. As part of safety in your home, you are also going to give up some of your privacy. These devices will record not only where you are when you want them to record things or people being able to check your apps, but they're also constantly running in the background, giving people access to your activity throughout the day. If you experience or the area experiences a power outage or they become disconnected, then the devices do not work and they will need to be reconnected. The other thing that you have to be extremely concerned about if you use technology is what we call cybersecurity. This is basically security threats. Each of your devices is going to be subject to some type of cyber hacking, and that is why you will want to have things passworded. You want to change the passwords. You'll have to have firewalls and other types of software, antivirus software, to make sure that, again, you do everything you can not to allow people to have access to your devices. If you do have any kind of security breaches or recalls, you'll want to also know that immediately. So technology can be your friend. Technology can allow you to do some of the things that you would not be able to do on a daily basis. It can allow you to monitor your health conditions, and it can allow you to continue to live in your own home. And with that, I would like to thank you for joining us today for this session on aging and technology. Please feel free to call our office if you have any questions at 303-333-3482, or visit our website at senioranswers.org. Good afternoon. I'm Eileen Dougherty, and I'm the director of the Colorado Gerontological Society. And I would like to talk to you about advanced care planning. There are 3 areas of advanced care planning: medical, financial, and legal. Let's start with medical. In a medical advance directive, you appoint an agent to make medical decisions for you when you are not able to do that. This individual needs to be 18 years of age or over. Unfortunately, Colorado is not a next of kin state, meaning that regardless of if you are married to someone, you are someone's child, or you are someone's parent, you are not able to make decisions for them. In order for you to implement a medical advance directive, you do need to have decisional capacity, meaning that you have to be able to give informed consent and know what you are doing. There are 8 types of medical advance directives. The first and most popular is the medical durable power of attorney. In this document, anyone that you appoint as an agent is able to speak for you and to make medical decisions, healthcare decisions, decisions about food, clothing, etc. You can use a pre-printed form, or you can go to the attorney and have them fill out a form. The individual you appoint has to be 21 years of age over, and they accept responsibility for making those decisions. A living will is a document in which you can complete if you have specific thoughts about what type of care you want if you were to be in a persistent vegetative state. This document is only valid if you are comatose and you are unable to make decisions for yourself. In that situation, the doctor basically comes together with your medical power of attorney or whomever, along with 2 other physicians, decide whether or not you will ever regain consciousness, and then can write an order if they decide that you are not able to regain consciousness, and 48 hours later can begin to remove life support systems. The CPR directive is often called the Do Not Resuscitate Order. In this directive, you are telling the medical personnel, the ambulance drivers and EMTs, if you want CPR or not. If you want CPR, then do nothing. If you don't want CPR, fill out the form, and then medical personnel will not perform CPR. The MOST form is a form that is used primarily with individuals who are at end stage of life. In this, there is a medical order signed by the physician that says what kind of care you want, if you have like infections, what additional medications you might want, whether you want hydration and food if you are dying, and if you want CPR directives. The next 4 types of medical directives are a medical healthcare proxy. This is a document in which your physician comes together with loved ones and or friends if you have not completed a medical power of attorney. The group appoints a healthcare decision maker who then assumes responsibility for making your healthcare decisions. The next one is the Medical Aid in Dying program. This is a statute that was passed a couple of years ago by the Colorado legislature and the voters, in which people who wish to end their life are able to do so. They have to be in a terminal condition. They have to see a physician. They have to get counseling. They can return then 2 weeks later. They pick up medications, and then they can administer those medications, which in effect causes their heart. They have to be of sound mind and able to administer the medications themselves. The next form is a behavioral health psychiatric form. This form is for individuals who have a psychiatric diagnosis and provides for advanced directives in case they have a psychiatric breakdown. It allows then the individual who is the agent to make decisions for them while they are in recovering from their mental health crisis and current situation. Again, the agent has to be 18 years or 21 years of age and over a point. A designated beneficiary is when 2 unrelated, unmarried individuals come together, and they then appoint each other to make both medical decisions as well as decisions about their estate. The form does need to be recorded by the clerk and recorder. So then the next question really becomes, what kind of medical advance directive should you complete? If you have a serious life-limiting condition, then you definitely want to complete a medical power of attorney. You may want to complete a CPR directive as well as a living will. If you do not have a life-serious threatening condition, you may still want to complete a medical power of attorney and possibly a living will, depending on your choices. If you want CPR, you need to do nothing. If you do not want CPR, should your heart stop, then you do need to fill out the do not resuscitate order, giving instructions to emergency medical personnel, as well as other healthcare personnel. If you are not able to communicate your medical needs and you have neglected to do a medical power of attorney, then your physician and other healthcare providers, as well as your family, can come together and appoint a healthcare proxy. Let's move then to the financial advance directives. Basically, again, if you are 18 years of age and over, you should appoint someone to make decisions if you are not. Colorado is also not a next of kin state for financial purposes. So just because you are someone's you are someone's spouse, adult child, or parent does not necessarily mean you have authority to make financial decisions. In order to complete this advance directive, you must have decisional capacity, meaning that you have to be able to give informed consent. There are 2 types of financial advance directives that you want to be aware of. One is a general financial power of attorney. The statute includes a pre-printed form in which you can fill out the form used by you individually if you just want to get a copy of the form, or often used by attorneys as well. You can give your power of attorney a limited power of attorney over certain financial affairs, or you can give them a full financial power of attorney in which they have authority to handle any cash that you have, any property, any investments filing with the IRS. Most banks and other financial institutions will initially recognize this financial power of attorney, but then may have you fill out a form of your own. The Social Security Administration does not recognize the financial power of attorney. They have what's called a representative payee. So the individual who wants to be your representative payee or whom you want to be your payee should visit the Social Security office, should provide information that is needed for the claims representative to take your information and decide whether or not you would be able and in the best interest of the older adult to make those decisions, and then the claims representative will appoint you. You do have to make a report to the court to the Social Security once a year. So financial forms that you should complete. Again, if you need someone to speak for you and you're not able to handle your financial affairs, then you should fill out a financial power of attorney. If you are able to handle your financial affairs, you may still want to fill out a financial power of attorney in case you faced a situation sometime in the future in which you were not able to make those decisions. It is only necessary to fill out the representative payee form at the Social Security Administration if you are no longer able to make decisions for yourself and you are cognitively impaired. At that point in time, your physician will complete a form submitted to the Social Security Administration. They then will work with identifying someone to be your representative. You can make this decision in advance by filling out a designated beneficiary agreement. If you do not take care of your medical and financial needs by filling out powers of attorney and or other associated forms, and you are no longer able to make informed consent because you do not have decisional capacity, then we can go to the courts. So if you are not able to make these decisions, then we go to the probate court, and the probate court then will appoint a guardian and or conservator to take care of your legal matters for you. The court can appoint a guardian. This legal guardian makes decisions then for the incapacitated person in the area of medical care, housing care, transportation, and other personal needs. The appointment is good for 1 year. You can be reappointed. You do have to make a report annually to the court so that the court can supervise and make sure that the guardian is acting in the best interest of the ward or the incapacitated person. If there is not much money involved, the guardian usually is also responsible for handling the financial affairs of the ward. If there is a larger estate, the court may also appoint a conservator. The conservator is an individual who has fiduciary responsibility for managing the individual's financial affairs. The individual who is appointed must be 21 years of age and over. The appointment is good for 1 year, and they too have to submit an annual report to the court. The conservator and the guardian are required to work together so that the conservator basically pays for the care and needs of the individual at the direction of the guardian. So do you need a guardianship? You only need a guardianship if you are incapacitated, cannot give informed consent, and have not appointed a financial power of attorney then we need to go to court and ask the court to appoint a guardian. Similarly, if you are not able to make cognitive or informed decisions, you have a cognitive disability, and you have not appointed a financial power of attorney, then we need to go to court and ask the court to appoint a conservator. The conservator then is responsible for managing your financial affairs. We also, at the same time, will need to go to the Social Security Administration and ask them to appoint a representative PAE, because just like the Social Security does not recognize a financial power of attorney, they also do not recognize a guardian. Other legal arrangements that we suggest that you consider is putting together a last will and testament. This is a document that says to your heirs how you would like to have your estate divided. Because your financial and your medical power of attorney die when you pass away, they are no longer valid, then you need to have a last will and testament, which appoints a new personal representative, could be the same person or the executor of your estate, to manage your affairs and take care of your funds. You also may want to consider purchasing a pre-need funeral. This will then help your personal representative and your executor take responsibility for your burial, as well as if you want a traditional burial and or a cremation. One of the things that the Colorado Gerontological Society has done is we have created some extensive resources that can help with advanced care planning. On our website at senioranswers.org, we have an extensive advanced care planning toolkit, which looks at medical financial directives, as well as gives you copies of all of the pre-printed forms. In addition to that, we have a series of videos on our YouTube list with a playlist on advanced care planning, again walking you through some of the issues as well as tutorials on how to fill out some of the forms. If you still need help and support, you're willing to call our counseling, referral, and support line. Our telephone number is 303-333-3482. Our toll-free number is 855-293-6911. And our Spanish line is 855-850-4777. That concludes my remarks today on advanced care planning. Thank you for joining us, and we look forward to seeing you.
We have seen the stress during the pandemic on individuals pursuing their path to recovery. Raleigh, Colorado has educated communities across our state about the importance of practicing safe disposal.
If you share ideas, you share resources, and you work around an evidence-based model or strategy, you get so much more done.
We just feel really, really lucky that this collaboration came together. It just shows that when we all work together, amazing things happen.
I'm so glad that Raleigh, Colorado has convened us here today to have these very important conversations.
About 25% of LGBTQ folks indicate they have a substance use disorder.
Bringing this awareness and having these conversations and really normalizing and humanizing what substance misuse looks like is so important.
For any of our folks viewing today who may be struggling with mental health or behavioral health issues, I'm here to tell you that there are people that care. There's resources available, and just know that you're not alone.